My first guest tonight is Ms. Stephanie Henry. You are the Director of Business Relations at Baptist Home Health Lexington. Did I get all that right?
Director of Business Development.
Okay, well, I got close. But you do primarily deal with home health.
Yes.
And in our practice, we send a lot of people to home health for multiple reasons, and when people get out of the hospital, they have home health. But who are candidates? Who are really people that benefit from it?
Well, really anyone who's had a recent surgery or has an illness would be a candidate. Patients that suffer from a chronic disease that needs frequent monitoring, such as heart failure, COPD, diabetes, hypertension, those patients are great candidates for home care. Really any patient that has a new diagnosis that needs some teaching, they really don't know what's going on, our nurses can go in and really provide some education. Patients who have a history of falls, obviously there's something going on and we can get PT in there to kind of assess their home and find out why they're falling. Just really patients with any kind of general weakness could benefit from some in-home strength training. And then patients who frequent the emergency room.
When I mentioned senior citizens, but it doesn't have to be. It's not always Medicare. It's not always elderly. It could be anybody that needs home assistance.
We get a lot of patients that maybe have a knee replacement or a hip replacement, and we're seeing that younger, in younger generations. So yeah, those patients, they may only need us for 1 or 2 weeks till they kind of gain their strength back and are able to go to an outpatient setting. But it's not just primarily seniors.
Now, you mentioned the knee, and you also mentioned when you were telling us the things you do, physical therapy. That's one thing you do. So you got physical therapy, and you've got some other services. Tell me about some of them.
We provide skilled nursing in the home. Our nurses do a lot of education and teaching with disease management and process. We of course provide post-surgical care and wound care. We do a lot with medications. Medications are huge. It's always different what a patient is discharged with from what they have in their home. And our nurses can go in and kind of really assess what they need to be taking. We work under the direction of a physician. So everything we do in the home is working with that patient's primary care doctor or their specialist. Like you said, we also provide physical therapy, really providing those therapists to come in and work on fall prevention, balance, strength, therapeutic exercises, things like that. We also provide occupational therapy, and occupational therapy really kind of differs from physical therapy because they deal with those activities of daily living. So they can assist with clothing, bathing, and really trying to find ways where patients can do that safely and really conserve their energy. We also provide a medical social worker who really acts as a resource for our patients and our families and really can help with those things that sometimes we don't really think about, like transportation to their follow-up appointments, or setting up Meals on Wheels, or working with patients that may not be able to afford their medications.
You talk about affordability, but and I guess there's some insurance coverages, and they probably need to work that out. But if you look at the whole picture, it's to keep somebody in their home, to keep them happy, to keep them comfortable. It's a lot cheaper to use home health than nursing home or a hospital.
It certainly is. It certainly is. And we know statistics show that patients age better. They do well when they're in their home environment, and that's our goal as home health, is to really take our patients to their maximum level of functioning so that they can remain independent in their home and they can age in place safely.
Now, you also mentioned one thing off the air. You said telehealth. Tell me about that.
So part of our heart failure program and our COPD program involves telehealth, and that's where we are able to monitor our patients remotely. We monitor their vital signs and then their signs and symptoms, and it really just allows us a daily glimpse into what's going on with our patients, and ultimately to really prevent a hospitalization or an ED visit. It really allows us, it certainly doesn't replace our visits into the home, but it allows us to maybe adjust our schedule. Maybe we need to call the patient and get some clarification, find out what's going on, call the doctor, do some intervention with medication, and really prevent that patient from going to the hospital.
It's great information. You all do a great job. Thank you so much.